Welcome guys again, and today our topic is introduction of blood bank. Now bank word suggests us to store something. So in the blood bank we store blood and their component. For the definition of blood bank is a part of hospital laboratory where we store the blood and do proper testing of that blood. And this proper testing to avoid the risk of transfusion related problem. It may be due to uncompatible transfusion, it may be some transmittable disease to recipient, so we have to avoid this with proper testing in the blood bank. Why we transfuse blood? In case of anemia where the patient having a low amount of HB, in case of blood loss due to some injury or accident cases, we have to compensate blood that is lost during injury or accident cases. Similar in case of surgery, we can also transfuse the blood, especially in case of pregnancy where the amount of blood is lost very much. In case of leukemia patient where the WBC are not a healthy one, so we have to replace that abnormal WBC with a new healthy WBC so that the WBC fight with the infection and save the life of that person. Another, in case of patient having a coagulation factor deficiency such as deficiency of factor 8, 9, so we have to transfuse fresh frozen plasma which is a component of blood, and we can also give cryoprecipitate in some serious cases. Now how blood bank work? Take example, a patient need a blood, so patient family member act as a donor, donate blood to blood bank. In some another cases such in case of leukemia or blood donation camp, voluntary donor who donate blood for the mankind, not for any personal purpose. Okay, so we donate blood to the blood bank. In the blood bank, we check the blood, and this is called processing in the blood bank. Finally, transfer to the patient or a required one. Now, types of work in the blood bank. So, first and important thing is blood grouping. We have to check the blood group such as A blood group, B blood group, or anything else by forward grouping or reverse grouping. Another is we have to also check some infectious that can be transmitted to some another by transfusion process such as HIV, very dangerous, hepatitis B and C, malaria, syphilis, etc. Another is term apheresis, okay, in which we have to separate the blood component so that we can give different component to different patient based on the requirement. Like if someone need only RBC, so why we give whole blood? It can increase the circulatory overload to avoid that the new thing is come in the blood bank is apheresis. So in this we can separate red blood cell or WBC leukocyte, platelets. As you seen, the process is simple such as centrifugation, in which we separate the RBC at the lower one, plasma at upper, and the buffy coat in middle which contain a platelet and WBC. We can also store the blood in the minus 70 degrees Celsius, which will become a fresh frozen plasma, and cryoprecipitate, which is very important in case of factor 8 deficiency or in case of von Willebrand disease. And here the end of video, and this is just an introduction to blood bank.